Amlodipine side effects. Everything you should know. Amlodipine stands as a widely utilized medication designed to manage blood pressure. It belongs to a class of drugs known as calcium channel blockers, or CCBs for short. This medication is readily available in tablet form with strengths of 5 mg and 10 mg. In both these dosage forms, amlodipine is formulated as its salt besylate. Additionally, an oral suspension version is also offered. Typically, the treatment with amlodipine commences with a daily dose of 5 mg administered once a day. However, for individuals deemed to be at a higher risk of cardiovascular complications, the dosage might be increased to 10 mg per day. It is paramount to understand the significant side effects associated with this medication for several crucial reasons. Firstly, amlodipine directly impacts your blood vessels. Given that numerous bodily organs rely heavily on the efficient supply of blood through your arteries, amlodipine can consequently influence the functioning of a broad spectrum of organs within your body. Secondly, the duration of amlodipine therapy often extends over extended periods, potentially spanning several years, and in some cases, a lifetime. This long-term usage is important because while some side effects manifest rapidly and are relatively mild, others necessitate diligent monitoring, particularly when the medication is used for very prolonged durations. Thirdly, among the calcium channel blockers, amlodipine is characterized by its long-acting nature. This property allows for a convenient once-daily dosing schedule. Nevertheless, its prolonged presence in the body can lead to accumulation with repeated administration, potentially triggering certain side effects after several months of consistent use. Therefore, prior to initiating treatment with amlodipine, a comprehensive awareness of its potential side effects and effective management strategies is essential. This video aims to delve into these key aspects in detail. Let's first explore the primary purposes for which amlodipine is prescribed. Amlodipine serves two main therapeutic goals. In cases of hypertension characterized by hardened arteries that present significant resistance to blood flow, amlodipine can help to relax these vessels. This relaxation reduces the elevated pressure, thereby decreasing the future risk of heart attacks and strokes. The second primary indication for amlodipine is in the management of angina, a condition where the heart muscle receives insufficient blood supply, leading to chest pain. This pain may radiate from the left side of the chest to the shoulder and neck. Amlodipine alleviates angina symptoms by dilating the coronary arteries, the vessels that supply blood to the heart muscle. This improved blood flow and oxygen delivery to the cardiac cells enhances the heart's overall function. In both hypertension and angina, amlodipine's mechanism of action is consistent. It inhibits the contraction of arteries, leading to their dilation. Calcium ions play a critical role in the contraction of blood vessels, and their entry into the cells is regulated by voltage-gated calcium channels. Amlodipine effectively blocks these channels, preventing this influx of calcium and thus inhibiting vascular contraction. However, this very effect of vasodilation, while beneficial, can also give rise to a variety of side effects. We will now examine these side effects systematically, prioritizing them based on their reported frequency and severity among patients. The most commonly observed side effect associated with amlodipine use is peripheral edema, which manifests as swelling in the ankles and legs. The incidence and severity of this edema are dose-dependent. Higher doses, such as 10 mg, are associated with approximately 3 times more swelling compared to the 5 mg dose. Amlodipine achieves vasodilation by widening the tiny pores within blood vessel walls, which increases their permeability. This enhanced permeability allows more fluid to leak from capillaries into the surrounding tissues, leading to localized fluid accumulation. Consequently, the blood vessels supplying the legs and ankles become engorged, causing swelling. To mitigate this leg swelling, it is advisable to elevate your legs while sitting. Gentle massage and soaking the feet in warm salt water can also offer some relief. It is also recommended to avoid prolonged periods of sitting or standing. while leg edema can sometimes be managed with diuretics, which promote the excretion of excess body fluids. The edema induced by amlodipine is not typically a result of generalized fluid overload. Instead, it stems from localized vasodilation. Therefore, diuretics may not always be effective in resolving amlodipine-induced leg swelling. In many individuals, this edema is mild and can be effectively managed through simple physical measures. However, in instances of significant edema, a doctor may consider prescribing a lower dose of amlodipine in combination with other antihypertensive medications such as ACE inhibitors or angiotensin receptor blockers. Another frequently reported side effect is dizziness. This sensation may be most noticeable with the initial doses of amlodipine, and individuals might experience a feeling of lightheadedness or even a state of drowsiness. These symptoms are common with medications that cause vasodilation in the brain, as a reduction in blood pressure within the cerebral arteries can lead to dizziness and confusion. Fortunately, this side effect of amlodipine is generally mild and tends to diminish with continued therapy, with most individuals experiencing a gradual reduction in dizziness over time. Nevertheless, if you experience pronounced dizziness or drowsiness, it is prudent to avoid sudden changes in posture. Fatigue, characterized by feelings of tiredness and weakness, is another potential side effect of amlodipine. This is not uncommon with many vasodilating medications. The degree of fatigue experienced does not appear to be directly related to the dosage of amlodipine, meaning it can occur at any point during treatment. Coexisting conditions such as diabetes or the use of other medications can also contribute to increased fatigue. However, severe or debilitating fatigue is rarely encountered. Maintaining a healthy diet rich in fruits and vegetables, managing calorie intake, and engaging in regular physical activity can help to alleviate fatigue. Palpitations, or a sensation of rapid or forceful heartbeats, can also occur with amlodipine use, even though the medication's primary action is on blood vessels. This phenomenon is commonly observed with drugs that directly affect vascular tone. As amlodipine lowers blood pressure by dilating arteries, it can reduce the pressure at which blood perfuses vital organs. To compensate for this reduced perfusion pressure, the heart may increase its rate of contraction, leading to a feeling of pounding or rapid heartbeats. In some instances, individuals may also perceive skipped heartbeats. This side effect tends to increase with higher dosages and may be reported more frequently by women than men. Flushing, characterized by redness of the skin, particularly the face, can occur due to amlodipine dilating the arteries that supply the skin, thereby increasing blood flow to these areas. This effect is also more commonly reported in women. Some individuals may experience mild nausea and abdominal pain when taking amlodipine. These symptoms are usually transient and may resolve as the body adjusts to the medication with long-term use. However, if severe abdominal pain is experienced, it may indicate an underlying medical issue unrelated to amlodipine. Somnolence or daytime sleepiness is another notable side effect. This can be exacerbated by feelings of low energy, dizziness, and drowsiness. It is observed in both men and women with similar frequency. While a primary purpose of amlodipine is to lower blood pressure, an excessive drop, particularly upon changing posture, can lead to postural hypotension. This is a rare side effect of amlodipine, but it can manifest as lightheadedness and dizziness when standing. The risk of postural hypotension may be amplified if amlodipine is taken concurrently with other blood pressure-lowering medications. This can increase the propensity for sudden falls, so it is crucial to consult with a doctor to ensure proper medication adjustments if severe hypotension is observed. Headaches are a common side effect of amlodipine. This is attributed to the medication's ability to dilate cranial blood vessels, which can stimulate sensory receptors in the brain and elicit pain. However, these headaches are generally mild and well tolerated by most individuals, often subsiding with continued use. Gingival hyperplasia, a condition characterized by the overgrowth of gum tissue, has been observed in a subset of individuals taking amlodipine. This is considered an idiosyncratic reaction, meaning it does not occur in everyone and is specific to certain individuals. Other potential side effects include skin rashes. Additionally, amlodipine may exacerbate certain conditions not directly caused by the drug. For example, rhabdomyolysis, a condition involving muscle pain and weakness, is linked to high-dose statin therapy. The risk of rhabdomyolysis may be elevated when statins are combined with amlodipine. However, this synergistic risk is not significant when amlodipine is used as a sole medication. These represent the common side effects of amlodipine that are important to be aware of before commencing treatment. This concludes our overview of amlodipine's potential side effects. We encourage you to share your personal experiences and insights in the comment section below. We wish you a healthy day.